This is my example of a red blood cell going through pulmonary circulation. This blood cell is starting as deoxygenized, and for this example is starting from the heel. Now, from the heel, it moves into the small saphenous vein. From there, it moves into the popliteal vein, and then it moves along into the femoral vein. Now, from the femoral vein, it moves into the external iliac and transitions into the common iliac. Now, since this is going from the leg, from the heel, it comes from the inferior vena cava and not the superior vena cava. It would come from the superior vena cava if it was coming through the upper body. So from the inferior vena cava, it goes into the right atrium, and then into the tricuspid valve and into the right ventricle. From the right ventricle, it goes into the pulmonary semilunar valve and into the pulmonary trunk. From the pulmonary trunk, it moves into the pulmonary arteries, and then finally makes its way into the lungs, where it becomes an oxygenized cell. From there, it moves into the pulmonary vein. Then it goes into the left atrium. From the left atrium, it goes into the bicuspid valve. From the bicuspid valve, it goes into the left ventricle, and then moves into the aortic semilunar valve. From there, it moves into the aortic arch. After the aortic arch, it makes its way into the common iliac artery and then into the femoral artery. From the femoral artery, it moves into the popliteal artery and then finally makes its way through the posterior tibial artery to finally make it back to the heel to be used again.